it hurts. And I am too sexy for Milan, too sexy for Milan, New York and Japan.
Welcome back, everybody, to Doing It with Stiles. I have, as promised, an extraordinary guest today. I think that you're all going to be fascinated by what we're going to talk about, I hope. And for all you people who don't watch, you lose. So I'd like to introduce Dr. John Brosious, is it not?
Correct, John Brosious.
Did I pronounce that correctly?
Correct, yes.
Cool. My English teacher would be proud that I can read. And you are a plastic surgeon.
Yeah.
Is that the correct term?
Plastic and reconstructive surgeon.
Plastic and reconstruction. Okay.
The bulk of what I do is reconstruction, and so a lot of people, when you say the word plastic surgery, everybody just assumes Botox and breast augmentation.
Yeah, that's exactly right. Which is one of the reasons of that I wanted to have you here.
Excellent.
So I've got this. I wanted to read this starting off to help clarify that, and it says, a plastic surgery specialist is a physician with extensive training in the execution of plastic surgery procedures. Plastic surgery is the use of surgical procedures to rebuild or reshape injured or misshapen body parts. Congenital defects such as cleft lip or palate can be corrected by a plastic surgery specialist. Injuries sustained during auto accidents also may require the services of plastic surgery specialists. These procedures fall under the category of reconstructive plastic surgery. The other category of plastic surgery is cosmetic plastic surgery, which we just talked about. Plastic surgery specialists often perform procedures like breast augmentation, facelifts, tummy tucks, liposuction, and lip injection as elective surgery for patients who wish to make aesthetic improvements.
Correct. That is a great dictionary definition of a plastic surgeon.
Good. All right. So, see, I did my homework. Now, my understanding, if my research is correct, and by research I mean I looked you up on Google.
Gotcha.
You specialize in reconstructive surgery.
Correct.
Laser resurfacing.
So I actually don't do a whole lot of that, to be honest with you.
The laser resurfacing?
Yeah, it's interesting. When you look up physicians online, a lot of these websites like Doximity, Vitals.com, they basically will put out what the most common procedures are for plastic surgeons in general.
Gotcha. Okay.
And so if you're looking at your list right now, I would say, as far as laser resurfacing, cosmetic surgery, hair restoration, and dermabrasion, I do very little of that.
Okay.
Skin cancer is in my wheelhouse because that's a lot of reconstruction.
Right.
But when you Google, what is a plastic surgeon, that's what 90% of plastic surgeons do.
That's what I came up with.
Yeah. And so my practice is very different than that. I do only about 10% cosmetic surgery.
Okay.
90% of what I do is in the realm of reconstruction, which is restoring form and function for patients.
Right.
Yeah.
And the other area that we're going to talk about extensively today, I believe, is called gender affirming surgery.
Gender affirmation surgery, yeah. So
which means exactly, what does that mean?
So if you think about semantics, when it comes down to gender care or even just talking about transgender, non-binary population, the wording changes almost on a daily basis.
Of course.
So if you think 10, 20 years ago, we used to call these things sex change operations.
Exactly.
And then that kind of evolved to gender confirmation surgery. And then that kind of evolved to what we call just gender surgery now. So then gender affirmation surgery was another term for it. But now we really just call it gender surgery. And the reason that we call it that and not sex change implies that they were born one sex and then that they change and transition to another. In the minds of these patients, whether they're transgender or non-binary, they were born how they identify. So, for example, a transgender woman, somebody who was assigned male at birth, has identified as a woman her whole life. It's not like this person at age 30 decided, I'm a woman. And so when you say things like sex change, that implies that something happened during the course of their life and changed their mindset. When you think about gender reassignment, that's the same thing. Is that you're reassigning their gender, but in their own eyes, in their own mind, they've always been the gender that they identify as. And so that's why the lingo has now changed to just gender surgery.
Gotcha.
The implication that these people have been how they identify their whole lives, and so it's not like they're changing anything. They're just affirming, they're physically affirming what they've mentally been experiencing their whole entire lives. And so probably 75% of what I do now is gender surgery, actually.
And a lot of people think that this is a new thing, but actually, and I had her name and then I forgot it, but this goes back 50, 60 years at least. And it was God, I had it right on the tip of my tongue too. A very famous, world famous, I think she was Swedish or something like that, that one of the first or early gender affirming surgeries. So this is older than most people realize.
Yeah, that's absolutely true. So there are certain parts of the world where the gender expansive community, and that includes transgender population, the non-binary population, people who identify outside of the standard male and female. There are certain cultures that have been welcoming to this for generations.
Yeah.
For example, Thailand is one of those places, as well as certain European countries. In those countries where it has been welcome, where the transgender community has been welcome for generations, they've been pioneering these surgeries for generations. So, for example, Thailand and kind of Belgium, Amsterdam, those kind of locations, they've been doing these operations for generations. But the rest of the world hasn't really been as accepting to not only that population, but this entire line of surgery. So people previous to maybe 10 or 15 years ago, almost everybody had to travel outside of the country to have some of these gender surgeries, to either somewhere in Europe or somewhere in Thailand, for example. There was very few people doing it around the world because there wasn't a huge need for that.
Right.
And then probably in the United States, really this changed with the Affordable Care Act. Within the Affordable Care Act, one of the requirements was that insurance companies have to pay for gender affirming surgery. And people always ask me, well, how is that fair? Why are we paying for this cosmetic surgery? Insurance companies don't like paying for things.
Right.
That's how they make their money, right? So they fought this tooth and nail. The last thing they want to do is pay for a cosmetic surgery.
Sure.
Well, the evidence has really come out that this is not cosmetic surgery. This is a life-saving reconstructive surgery. You know, if you think about a transgender person has a 40% risk in their lifetime, statistically, of a suicide or a suicide attempt. So these patients are suicidal. These patients are depressed. There's a whole host of psychiatric conditions that result from the fact that their mind and their body are not congruent. And so studies have now borne out that these patients with hormones and surgery, these patients, their self-harm rates go down, their suicide rates could potentially go down, their integration into society is improved, their quality of life improves. So now that the evidence has shown that these are medically necessary procedures, the Affordable Care Act and many insurance companies on certain parts of the country have decided that we're going to cover these services because these are truly life-saving. And so it's really part of the Affordable Care Act that these should all be covered nationwide. However, it's a state-by-state kind of battleground, a legal battleground. So you have some of the more progressive states like California, Nevada, Colorado, Washington, and Oregon have been paying for these surgeries. The Medicaid, the Medicare, which are the government insurance, as well as commercial insurance, has been covering these surgeries, as well as the state of Nevada for several years. And then you have some more conservative states where, you know, the insurance companies are basically saying, we're not going to cover this until essentially lawsuits are filed. Once a lawsuit is filed, then the insurance companies have to back down because these really are truly covered and protected by the Affordable Care Act. However, the transgender population and the non-binary population, they're very marginalized. They don't come from a lot of means typically. It's hard for them to kind of move up the ranks in the corporate world, in the educational world.
Right.
And so it's hard for them to mobilize an army of attorneys to fight a mega insurance company.
Exactly.
So some of the more conservative states, it's still not a covered benefit. For me in the state of Nevada, you know, for the last several years, it has been covered by the insurance companies. And so that's what makes gender affirmation surgery a reconstructive surgery, in my opinion, not a cosmetic surgery. This is not for appearance. These people did not choose this life. Anybody who thinks that a transgender person, you know, chose this life, I challenge them to spend one day with a transgender person, and nobody would ever choose that.
Right.
It's a tough life to live for them. The world has not been kind to the transgender population.
And if I'm not mistaken, you are the only surgeon in the state of Nevada at this point, right?
So I'm the only surgeon in the state of Nevada that does the genital surgeries for the transgender population and the non-binary population. There are a few other surgeons that'll do the chest surgeries, which are a little bit less complicated.
Right.
You know, I do about.
Can you clarify that when you say the chest surgery?
Yeah. So
is
let's
that augmentation or reduction.
Exactly. It could be either one. So let's just backtrack a little bit to what is gender affirmation surgery.
Please.
So, you know, as I'm the director and the founder of the Gender Affirmation Surgery program at UNLV School of Medicine, I'm also an assistant professor at UNLV School of Medicine. When you think about gender surgery, even though this is a subspecialty within plastic surgery, there are subspecialties within gender surgery. So let's just talk about head to toe, the different operations that you can get as a gender expansive patient. So from the face alone, facial feminization surgery is actually a specialty within gender affirmation surgery. And one of my partners at UNLV, he did a specialized training in facial reconstruction. He actually offers facial feminization procedures. Working your way down to the neck, I have ear, nose, and throat colleagues who do tracheal shaves, which is basically the Adam's apple procedure for the transgender women, as well as voice modification. So they can actually manipulate the vocal cords to change the pitch of the patient's voice. If you go down a little bit further to the chest surgeries, that's basically the bulk of my practice is chest surgery and genital surgery. So chest surgery will be chest masculinization and chest feminization. Chest masculinization is basically double mastectomies for the transgender men, which is what I like to call a cosmetic mastectomy, because this is a mastectomy that it's not done for cancer, it's done to look masculine.
Right.
So it has to look good, it has to
Sure.
look masculine. And then breast augmentation is typically the procedure that we would perform for a transgender woman. If you work your way down, obviously, to the genitals, the main two operations would be vaginoplasty, and I'm the only one in the state of Nevada that does vaginoplasty, and that's male to female genital surgery. Essentially, it's the creation of a fully functional vagina and vulva that can have sexual intercourse, that can have orgasms and look very realistic. And then phalloplasty is a procedure that I plan on offering probably by next year, hopefully. Phalloplasty is the creation essentially of a penis and scrotum from scratch. The reason that I am not performing that operation is that with vaginoplasty, the studies have shown that 75% of women want this operation. They basically want to have their genitals feminized, and for a lot of them, it's a safety issue. This is not a functional issue. They're not.
Can you repeat that when you say 70%?
75%. So 75% of transgender women.
Transgender women.
Yeah,
Okay.
yeah.
I'm sorry. Yeah. I didn't hear the transgender.
I'm sorry. Transgender
okay.
women.
All right, thank you.
About 75% of transgender women have either had or desire genital surgery, and whereas with the transgender men, there's a lot less that desire the genital surgery, and the reason is the functionality and the price that you're paying for that procedure. For example, for vaginoplasty, the reason that I learned that one first is that, number one, it does not require a urologist to work with me. I had a hard time finding, other people who are willing to do these procedures with me. So I realized that, with vaginoplasty, the urology part is relatively simple. I'm just going to learn the urology part on my own and do that part as well as the plastic surgery part. The reason more transgender women want the bottom surgery. So when you talk about, gender surgery, people always talk about top surgery and bottom surgery. Top surgery is simply chest surgery, like we described. Bottom surgery is genital surgery, which would make sense. The bottom surgery for the transgender women, it's more functional, and there's less risk involved in terms of long-term complications. And a lot of the transgender women, this isn't about function. This isn't about appearance of the genitals. If it looks beautiful and then they can have sex and have orgasms, that's a home run. But for a lot of them, this is a safety issue. These patients have a penis and testicles that they have to essentially hide in public. They have to, tuck it if they're going out in public. If they go to the airport, God forbid they get screened because something shows up on a scan, or if they get arrested, which jail are they going to go to? It potentially is a safety risk for them to have this hanging body part. So for a lot of them, it's just about removing that part that causes a safety issue. And so for that reason alone, a lot of them want the surgery, let alone the function that they can get from it. When it comes to a transgender male, creating a penis from scratch means I have to take tissue from another body part and transplant it to the genital area. And then so I'm creating a hole in another body part. And so there's some morbidity with that. And then the function of the phalloplasty, which is the construction of a penis and scrotum, is a little bit less than a vaginoplasty in terms that the urinary complications tend to be higher. The ability of them to have sex is typically lower. And you may even give up the ability to have an orgasm if you have this phalloplasty, because we may have to remove body parts such as the clitoris and the nerves that go to the clitoris in order to perform the phalloplasty.
Gotcha.
So for those reasons, the majority, in my experience, of the transgender men don't want the genital surgery because it's too heavy of a cost to pay and not necessarily worth the benefit. Certainly, there are patients that really want this procedure, and I will be offering that in the future. But that operation, I think, it will be less yield for me to learn initially because, number one, I needed to find a urologist, and it took some time. I did finally find a couple of urologists, but also a lot less of the transgender men want this operation as opposed to the transgender women. So COVID's kind of screwed my plans up a little bit. I was hoping to be actually performing phalloplasty by now. I do microsurgery as well as my partner, so that's required for part of the reconstruction is reconnecting essentially small nerves and blood vessels.
Right.
So I just need to be able to take my urologist to train in their part at a different institution elsewhere in the country. And with COVID, they're not allowing guests at most of these universities where they do these procedures. So that's basically head-to-toe gender affirmation surgery. And as a matter of fact, there's another field, which is limb lengthening. And I have a colleague in town who's an orthopedic surgeon who's worked with several transgender patients who can actually grow your legs several inches for a lot of money, but he can make you taller or shorter so as to be more congruent with your gender role. So when you talk about gender affirmation surgery specifically, there's a whole plethora of surgeons that are involved because ear, nose, and throat doctors are the ones that do the vocal cord modification. My partner, he's a craniofacial surgeon, so he does facial surgery. We have gynecologists doing hysterectomies, and then my urologist will be helping me with the genital surgeries as well. So it's multiple different specialties within that specialty, and each one is done by kind of a different doctor. But I'm the only one in the state of Nevada that currently does the genital surgeries. And as far as the chest surgeries, I do about 200 of the chest surgeries a year, so I'm the highest volume by far of the chest surgeries. There are some other plastic surgeons that'll do breast augmentation and then mastectomies, but they're doing much smaller volumes than me. So
and that's just here in Nevada?
That's just here in Nevada,
so 200 a year?
I do 200 chest
just
surgeries.
You.
Yeah, that's just me doing about 200 chest surgeries.
That number totally blows my mind.
Yeah.
That there are that many people, transgenders or for whatever reason, here, and those are just the ones that qualify for the surgery or can afford the surgery
or even desire the surgery.
Or desire the surgery. So, wow, that's nationwide. This is bigger than I think most people realize. And that was one of the reasons why I wanted to have you come in.
Yeah.
It's one of your patients, and I won't mention her name on the air, but we did an interview a little over a year ago about this issue and what she was going through, and was extremely open and honest about all of her experiences, and so that's why I'd asked her. I said, any chance you can get me to talk to this guy? It's because I'm an old white guy. I have ingrained in me societal norms for a long time. And so subconsciously, I think that and this is just a personal opinion. I have nothing to base this on other than my own experiences. I think that a lot of the blowback or the negativity that comes from regarding LGBTQ or transgender is fear on the part of, I know that I'm sometimes overly cautious. I know probably more transgender people than most people do, but I'm always very aware. I don't want to say the wrong thing. I don't want to offend them. I don't know. So sometimes you just, excuse me, you don't say anything, or you try to avoid the situation, and that's sad.
Yep.
Because the people that I know are really some awesome people, and just because they have a little different psyche or whatever than I do, I know a lot of autistic people. And it's I don't know. It just it's weird.
Yeah, I mean, what you're describing to me is the way a lot of people feel.
Right.
Is that I've even had medical students. I work for the School of Medicine, so I have medical students that shadow me. Sometimes when they're shadowing me in the clinic, I'll say, "Hey, do you want to go see Mr. So-and-so? He's a transgender man. Do you want to go get the history from him?" And the medical students are oftentimes reluctant. They say, "You know what? Doc, I'm not comfortable going in and talking to him because I'm afraid I'm going to use the wrong pronoun, the wrong name, refer to a body part that's not comfortable." So, one thing that I realized very early when I started working with the gender expansive community is that as long as you're not doing anything maliciously, they're not going to be upset if you misgender them or use the wrong pronoun. As a matter of fact, I like to consider myself the pronoun pro at this point. With the majority of my practice being gender surgery, it's really hard to get me hung up. But what I'll see oftentimes is it's very common to have couples coming in, a transgender couple, right?
Right.
A transgender man and a transgender woman. I mean, these people will meet because they have something in common. And so I have a lot of husband, wife, girlfriend, boyfriend, girlfriend, whatever, coming in, and they're both from the gender expansive community. And sometimes I'll be in there saying husband, wife, he, she, and sometimes I'll screw up and they'll catch me and then we'll just kind of laugh together. So they know that as long as your heart's in the right place,
I think that's true.
they're not going to be upset if you use the wrong pronoun. I mean, certainly there's some people out there that may be sticklers, but it's really people that are not in the gender expansive community, that are not transgender, that will give you a hard time for using the wrong pronoun. The people in the community, they just want to be treated like a human being.
And that's the comment that I've heard more than any other. I just want to be treated like a human being.
Yep.
And I think that's where we need to learn a little bit, guys. About all of this. I after that statement that you made, I want to read something here. This is you've got some awards here, and one that I thought was two here that I thought was really pretty good. One is this was in 2020, 2018, and 2015. You got the Compassionate Doctor Certification or Award, and it's granted to physicians who treat their patients with the utmost kindness. The honor is granted based on a physician's overall and bedside manner scores. That and the Patient's Choice Award for 2020 and 2018. That's a recognition reflects the difference a particular physician has made in the lives of his or her patients. The honor is bestowed to physicians who have received near perfect scores as voted by your patients. I don't believe there's many doctors around that could say something like that. All of my healthcare comes from the VA. I'm very fortunate. We have, from my perspective, an incredible VA system here in Southern Nevada. I've have some medical problems. I have a bladder cancer, and so I've had some surgeries, procedures. I forget what they call them, but you know what I'm talking about. And every time I've been there, every doctor I've met, every nurse, every PA or whatever, always make you feel like they're very happy that they're there and they're helping you and they care about you. And that's hard to find. Yeah. That's hard to find in a doctor. And I mean, before I got all my stuff from there, I get better care there than I've ever had from any private medical company. Yeah. So, well, there's been a couple of exceptions, but for the most part. So, what prompted you to get into this line? I'm sure that's a question
that's a very common question. People always ask me, how did I find this very specific niche in healthcare? And so, people would like to think that, well, maybe he has a transgender brother or something like that. And I'll be honest, I hardly knew any personally knew any transgender people growing up. The reason I got into this actually was, so I finished my training. I actually went to medical school at Indiana University, and then I actually came here as at the University of Nevada for my residency. So after you finish medical school, you have to do what's called your residency, which is like your apprenticeship. Right. So I did my training here, and it was from 2017 to 2013. When I graduated, it was the tail end of the recession. So imagine you're a plastic surgeon going out into practice. I took a job in Pittsburgh, Pennsylvania. I'm from Pennsylvania originally, by the way. I took a job in Pittsburgh, and during the recession, plastic surgeons, they weren't doing cosmetic surgery because people couldn't afford it. So it wasn't like I was going out into practice and I had 20 women who wanted a breast augmentation filling my office right off the bat. If I wanted to eat, I had to do anything under the sun. Right. So I initially started taking trauma call at every trauma center in Pittsburgh. I was doing burns. I was doing chronic wounds. I was doing pressure wounds, bed sores, diabetic foot wounds, the most unsavory of the unsavory, just to pay the bills. And so I kind of got this reputation in the city of Pittsburgh that this is the guy that won't say no to anything. Right. Anything that comes in the door, he'll say yes to it. And I was kind of proud about that because I didn't ever do any specialized training after my plastic surgery apprenticeship. And so I liked the fact that I could do everything head to toe, cosmetic and reconstruction. So I started getting phone calls from transgender patients. And they were asking, hey, we heard that you're willing to kind of do anything. Are you willing to do transgender surgery? And my office staff asked me, and I said, look, I've never done it, but I'm pretty sure I could learn it. I've learned all kinds of different surgeries over the years. So I'll never forget this. This was around 2015, maybe. My first transgender patient came in for a consultation. It was a transgender woman. It was very obvious that she was transgender based on her build. It was pretty clear. And when she came in, I had a consultation about breast augmentation. And at the end of the consultation, she started crying. And so I immediately thought, I used the wrong pronoun.
No.
I was, again, like you just
That's
described,
good.
I was afraid to, even almost afraid, kind of step, like I was walking on eggshells during the whole consultation. Like, how do I not offend this person? And so she started crying. So I thought immediately, all right, I definitely hurt her feelings. So I said, what did I do to offend you? I'm sorry. And she said, no, you didn't offend me. You're the only doctor in the entire city that's treated me like a human being. She said, usually if I've gone into a regular doctor's office, they kind of shoo me away, or if I've been to a plastic surgeon before, as soon as they see me, they're like, well, we don't treat your kind.
Right.
And I was appalled that, this is 2015 and we're treating people in the United States like second-rate citizens. And so I did her surgery. It went off without a hitch. She did fantastic, and she was the happiest patient I ever had. And so that's when I really had a passion for gender surgery, and I realized that this is an entire marginalized community that's been left behind by the healthcare system. Pennsylvania was not paying for gender affirmation surgery, so this particular patient, she was a hairdresser. She borrowed money from everyone she knew just to afford the surgery. And so it was really a touching story. And so that's when I started doing more and more gender surgery. And in Pennsylvania, these surgeries were few and far between because insurance did not pay for that.
Right.
So then when I moved to Las Vegas, so I was in Pittsburgh practicing for about 3 years, and then UNLV asked if I would come back and be the director of the training program here. So I moved back here in 2016, and that was right around the time that Nevada, Medicaid, Medicare, and the commercial insurances were starting to pay for gender surgery. So when the transgender community caught wind that I performed these surgeries, the floodgates just opened up. And so I would have, one day I would have one patient in my office. By the end of the week, I'd have 5 new patients in my office, to the point where now I'm doing 200 of them a year within about 2-year period. And so after about 6 months of doing the chest surgeries, which were pretty straightforward to learn,
Sure.
the patients started asking me about the genital surgeries. And I said, okay, well, who's doing them now? And they said, well, there's nobody in the state that does them right now. There's very few people in the country that do them right now. We have some people in California, there's some people in New York, and a couple smattering of people throughout the country, but there's only a handful. And they typically don't take out-of-state insurance, and the patients don't want to have this massive procedures and then have a complication. There are surgeons across the country. So I said, okay, this isn't the first time I've learned something new. I said, I will learn these surgeries for your population, and I'll bring them to Southern Nevada. And so that's when I made this kind of promise to myself and to the patients that I'm going to learn the genital surgeries, and I'm going to try to recruit as many people that are involved with gender care, because it's not just the surgeons. I mean, we have to have mental health professionals,
Right, and
hormone doctors.
It's not just hey, I want to do this.
It's not. This was a huge endeavor, John. It's not like if I wanted to do hand surgery or breast surgery, I could open up shop tomorrow and have an office full of people, and I can do breast surgery all by myself. Or if I was a hand surgeon, maybe one physical therapist. But I needed to find all the different surgeons to help me out for the head-to-toe surgeries. I needed to find the mental health professionals to sign off on the patients for surgery. I needed to find hormone doctors. I needed to find advocates of the community like yourself to help kind of push the message. And I also had to find people in the state legislature to help push our cause and to help push legislation to protect this population. So this was a huge project, starting a gender surgery, just a gender program, a gender medicine program. And so then I actually took my own vacation time and my own money, and I traveled out of state to learn the vaginoplasty procedure. I went to conferences on the procedure, and I studied. I literally read every single article that was published in the medical journals from the 90s till today on these surgeries to learn them, because this is a very unique surgery. But I was not new to learning something new. I mean, one of the beauties of plastic surgery is that we're often called to use creativity and learn something new on a case-by-case basis. There's no two cancers that are the same. There's no two injuries that are the same. No two birth defects that are the same. So for me, it was nothing new to learn something out of the ordinary. And so that was I actually did my first vaginoplasty here in the state of Nevada in August of 2020. So I just had my 1-year anniversary of doing that procedure. So now it went from doing just a smattering of this earlier in my career to now about 75% of my practice is gender surgery. And so that's kind of how I got into it. I had a Catholic upbringing. I'm not really religious anymore, but the one thing that I kind of took with me into my adulthood was, treat the marginalized, treat the poor, and that's why I became a doctor. I became a doctor to help people, and so this is my way as one single individual to make a huge impact on a community that's been kind of left behind. And they're the coolest patients that I've ever had. I mean, the transgender population in Las Vegas is very unique. It's very different than Pittsburgh's and probably anywhere else. What I've known after meeting hundreds of transgender people is that a lot of them were kind of marginalized by their friends, their family, and so when they kind of came out and transitioned publicly, they were shunned by their families, and so they all picked up and left and started a second life in a place where the people are a little bit more open, and that's Las Vegas.
Yeah.
And so I have a unique population that a lot of people came here to have a little bit more freedom and a little bit more less judgment. And so I have a really cool population. It's a huge population here in Nevada, and they it's almost like they're inspiring to me too. I mean, you look at me, I'm covered in tattoos, and you think, what kind of doctor looks like this? And my whole entire family.
I wasn't going to bring that up.
All my family and friends were like, when I started tattooing my hands and my neck, and they're like, what are you doing? You're a doctor. This is going to be horrible for your practice. And I said, look, my patients, they're not going to judge me for how I look.
Right.
They've been judged how they look their entire lives. And half of them have.
That's an excellent point.
Yeah,
I never thought of that.
They're never going to look at me. It's like
Right.
a judgment-free zone in my office. You know, half of them have face tattoos and purple hair. So the minute that they see me, they say, you know what? You don't look like you're going to judge me. You look like you're down to earth, and I feel like I'm ready to open up to you. And so
Right.
I have not had a single patient look at me and say, this guy with his neck and his hands tattooed, this guy can't be, he must be a hack. So they're kind of inspiring because these
Now,
patients.
see, I would say just the opposite. I said, the guy must be really good because look, he
Yeah.
can afford all that ink.
Yeah, that's true. Yeah, I've had some other patients say, "Yeah, you must be good at what you do because otherwise, who would go to you looking like that? You look like you're a bartender." So the way I looked at it is, I saw these people. They're the transgender population, the gender expansive community. They're proud to openly be themselves. They don't care what society thinks about them
Right.
and how they look and how they appear to the world. And so that's kind of inspiring to me. I mean, having a tattoo is very different. It's not like walking in the shoes of a transgender person, but it really allowed me to say, you know what, I'm going to start being myself. I don't care what people think about me anymore, based on how I look. It should
Right.
be all about what's inside and who
Yeah.
you are. And so in a way, they relate to me. So I think I'm very relatable to them, which is why I think the community and myself hit it off real good, so real well. So that's how I got into gender surgery. It's not like I had a sibling or I had an experience when I was young.
Right.
It was really that I thought that, hey, look, I found an opportunity to help a tremendous amount of people. It certainly would have been a lot easier if I did Botox and boob jobs all day. Probably would have made a lot more money and a lot less headaches with insurance companies. But at the end of the day, I sleep well knowing that I'm saving lives.
Right.
Yeah, as a plastic surgeon, we don't save lives a lot. I save limbs, I save fingers, I reattach arms and fingers as part of my trauma. Our group is the only group that does the limb and finger reattachments in the state of Nevada. So
Wow.
we do a lot of that stuff too. So, like the last 4th of July, a guy blew his thumb off with fireworks. We had to reattach his thumb. So, I do a lot of that kind of stuff too. And so I realized that, I could probably help a huge population by focusing on gender surgery, even though it's going to be a little bit harder. I kind of like the challenge, and I like that I'm changing lives. Botox, breast augmentation, certainly you're helping people out.
Well, you're helping them get a date.
Yeah, exactly. Helping them get a day. You're helping them, on Zoom because everyone's looking at their face now. So there's this cosmetic surgery boom right now because everybody sees themselves
Really?
on the screen. Yeah. So my
No kidding.
cosmetic practice. The cosmetic
Because of Zoom.
part of it's because people are seeing themselves on a screen all day, and the other part is people are staying home. They have time to recover.
Right.
They have money because they're not traveling. The pandemic's been a really weird time. Rich people are getting richer and poor people are getting poorer.
Yeah.
So the rich people have time and money. So cosmetic surgery is like exploding right now.
Yeah.
But yeah, for me, I went into medicine to help people, and I couldn't find a way to help a larger community than the gender expansive community, and so that's how I got into it. I know that was like a long-winded story.
No, but I mean, it's obvious that you're passionate about what you do, and that is so hard to find in any vocation today. It's and please send your cards and letters too. But I've had experience with doctors or physicians and they're obviously just in it for the bucks. How many patients can I get through the door today?
Yeah.
And, it's like, here, take this pill and get out of my,
Yep.
And so whenever I run across someone who is passionate about what they do, as I am, I love what I do here. It's refreshing and it's affirming. It's like, all right, there's some hope.
Yeah, I think, and I like to think that a lot of physicians went in with the right mindset, but it's the healthcare system can jade you quick. You talk about getting as many people in the doors as possible. Insurance companies, they're paying less than they've ever paid, and so you're forced to see more patients and cram them into shorter schedules. And the patients are upset because now there's more out-of-pocket co-pays, and so it's almost like you're set up to be miserable.
Right.
And so people go in with these kind of these ideals, and then when they get into the practical matters of being a doctor, it's not as glamorous as people think, and so people get burned out and jaded real quick. And so if you don't have a real passion, if you don't if at the end of the day you don't sleep well because you're taking care of people, if you were in it for the money, you're not gonna be happy.
Yeah.
And so I see a lot of people who are disappointed because they're not financially as rewarded as they thought, or their patients are irritated with them because they just don't have the time to give to patients.
Right.
So it's healthcare is what it is. I personally think this could be a whole nother podcast, but healthcare in America it's really a travesty.
Oh, it is. It's one of my pet peeves. So
Yeah.
my ex-wife was medical secretary, unit secretary, and so I mean for years and years and years, and so I know some of the things that she experienced was just, she'd come home in tears.
Yeah.
Just because this person or this patient needs help and there's nothing they can do.
Yeah.
And because the insurance company won't let you,
Yep.
or whatever, and that's we'll have to come back and
That's
talk
a whole
about
nother
that.
podcast.
Yeah,
I could talk for hours on that alone. But
it's just I just can't believe that. I want you to be the healthiest person you can be. And I want to be the healthiest person I can. I have friends and relatives all over the world, and we are the only developed country in the world that doesn't have, health care for.
It's sad.
It's criminal.
Yep.
It's not sad. It's criminal. So
It's
send your
truly-
cards and letters to. You got the address.
It's truly unbelievable. I mean, the fact that we don't have a universal healthcare in the United States, it just blows my mind.
Yeah.
And it's money talks, and these insurance companies have all the power.
Yeah.
And so it would require an overhaul of a culture, not just getting rid of insurance companies. And so that's just who knows? I highly doubt in my lifetime I'm going to see what I really want to see, and that's universal healthcare for everybody. And you walk into a clinic and you don't have to pay a dime, and you don't have to worry about your copays. And I mean, I'm a physician. I don't even know my insurance plan. When the doctor's bills come in, I just pay them. But
Right.
I have that luxury because I have a good job. But
Well, there was in the news this morning. They were talking about they were talking about Bill Clinton, and his health situation right now, and the newscaster was saying something like, or the guest was saying something like, well, when you have a problem or you think that there's something wrong, you need to go right away and get it checked out.
yeah,
Most people in this
No.
country can't do that.
They can't afford to.
Especially right now. They'll wait until it's too late to go and get, because they don't have the money. They can't, I can't afford this or
yeah,
whatever.
the money, the time
That's
off
it.
work.
And-
Yeah, absolutely.
And I'm sorry, we're going to have to take a quick commercial
Sure.
break, and then we'll be back. And so check out these messages so I can pay my bills every month and keep the doors open and keep presenting a great situation like this. So we'll be back in just a moment. Thanks a lot. See, now that wasn't that long, huh? And you learned something in the process. I'm back here with Dr. John Brosious, right?
Brosious, yep.
See, nailed that. We've talked about so much. I know that you do a lot of work at UMC, which is actually a teaching hospital, and you also teach at UNLV. Can we talk a little bit about that and
Yeah.
what exactly?
So let's talk about medical education in Southern Nevada. So
Outstanding. Go ahead.
So the thing with Nevada is it's really, the healthcare traditionally had been really a bad situation in Nevada for a long time. As a matter of fact, the running joke was, where do you go for healthcare in Nevada? The best healthcare is at McCarran Airport.
Yeah, I know.
And so the UNLV is actually, I believe it's the newest medical school in the country. So up until 4 years ago, University of Nevada, Reno was the only medical school in
Right.
Nevada. And UNLV opened up their doors. We just graduated our first class of doctors last year. So it's been open for 4 years. Certainly some growing pains with the new institution. But the goal is we're trying to expand the number of doctors in Nevada. Part of the reason that healthcare is so poor in Nevada is not only do we not have some of the specialists, but we don't have the number of primary care doctors either. We just have a shortage in general. So with having this brand new medical school, which I'm a faculty member of, we're hoping to churn out a lot of these doctors to kind of fill the need. And we're already short doctors in Nevada, and we're a growing population. I mean, Nevada, people are moving from California. People are moving from all over the country because of the cost of living, ability to work remotely. People want to move here because it's cheaper than living on the coast. And so we really need to be poised to catch up before these people get here, because we're already behind.
And that's just it. We have been, for the last I don't know, 20 years at least, we have been playing catch up.
Yeah.
And not getting ahead, you know, whether it's our roads or you know, everything.
It's been yeah.
And there was a woman that I interviewed a couple of years ago, and I wish I could remember her name, but she was, it was right at the beginning of the opening of the new medical school there at UNLV. And so this is your first class that has graduated.
Yeah, we just graduated our first class, so that means we've been just over 4 years. Medical school's 4 years, so we just finished and graduated our first class. So hopefully this will start to fill the need, and we'll start to, you know, before the masses start coming here in droves, which they already are, we can kind of catch up a little bit, and there can be more providers. So that's one good thing that's going. So not only is UNLV Medicine going to create more doctors for Southern Nevada, but it also raises the bar for the standard of care. One thing I noticed when I was training here in residency, that things were good at UMC Hospital. We were kind of doing the standard of care. We're doing the latest and greatest. But if you go to the community hospitals, there's not a lot of oversight of what's happening with a lot of these physicians. Right. And so people were doing things. I like to say that, you know, Nevada was 10 years behind in medicine. And there wasn't a whole lot of oversight because there was no medical education institution which kind of set the bar for the community. So not only are we churning out new doctors, but we're bringing in physicians like myself who do some more of the cutting edge stuff like transgender, a lot of the other stuff that some of my colleagues are doing, both in the surgical and medical departments. But we're setting the bar, a new bar for Nevada. So that way you can't just be doing whatever you want, you know, down the street at the community hospital, because people are now able to see, look, we can provide state-of-the-art care at not only UMC Hospital, which is affiliated with the UNLV, but we really strive to produce that care everywhere. So that's the nice thing about a medical school, is it does two things. It brings more doctors into the community, but it also raises the bar to what the standard of care should be, because we have a lot of catching up to do here in Nevada. And so that's the one nice thing about the medical school. And then within the medical school, that's just the medical students. So that's medical school, which is 4 years after college. And then in order to do, you know, be a licensed physician, you have to do your residency.
Right.
So we're expanding all of the residencies to kind of accommodate the needs for primary care doctors, specialists. And I'm actually the program director of the plastic surgery residency program. So I wear a lot of hats. You know, I'm the director and founder of the gender program, professor of UNLV, assistant professor at UNLV, and I'm also the director of the plastic surgery residency program. So I was actually, you know, a resident of my own here up until 2013. So now I'm very proud to be the director of the program. And so we have to get into plastic surgery. It's the hardest, or one of the hardest specialties to get into. For example,
Really?
we only have one spot per year. We take one medical student per year for our training program, and it's a 6-year program.
Wow.
So that means I only have 6 residents. So I usually get, like this year, for example, interview season's coming up. I get anywhere from 250 to 400 applications for that one spot. And now I have to go through, we kind of weed them out with board scores and things like that. And so I got a stack of 155 applicants that I have to go through, and we're going to invite maybe 20 of them or so for an interview in a few months to get that coveted position. So we really get the cream of the crop when it comes to plastic surgery, and a lot of the subspecialties are like that as well.
May I ask why you only have one a year? Is it budget cut, or budget considerations, or
it's really because there's
not capable of handling more than that?
Well, most plastic surgery programs around the country have only about 2 residents per year.
Okay,
it's just not.
So that's not.
It's not a huge special, even though to the general population, we see plastic surgery in the media. We see it on TV. We see it. It's very prominent because of cosmetic surgery.
Sure.
So we think there's a lot more plastic surgeons, but there's probably, in the country, there's probably 10 orthopedic surgeons for every 1 plastic surgeon. There's probably 20 general surgeons for every 1 plastic surgeon. So even though we're very visible as plastic surgeons, as a community, we only graduate a few hundred every year.
Wow.
Whereas you're graduating a few thousand orthopedic surgeons every year, you're graduating a few thousand general surgeons. There's just not the need for plastic surgeons. That's why there's only 1 spot per year here. In other institutions, for example, at Pittsburgh where I was, there was only a handful of people every year that would go to that residency program. So it's not so much that budget cuts, things like that. It's just that there really isn't that big of a need for plastic surgeons.
That's right.
As a matter of fact, here in Southern Nevada, of all the shortages that we have, we really don't have a shortage of plastic surgeons. They're just not doing reconstructive surgery.
But that makes sense.
Yeah.
That makes sense.
It makes sense because we're Las Vegas.
Entertainment capital.
Yeah, entertainment, and this is a town where when I first moved here, I realized how flashy this town was. I saw every other car's a Mercedes. I thought, where I grew up, only the doctors and the lawyers had the Mercedes. And I came here, every other person drove. I thought this is the wealthiest town they've ever been in. And then I realized these people are spending their last dime, or they're borrowing money for these vehicles. And so this is a town really that shows off a little bit more than others. So there's a lot of cosmetic surgeons, but not a lot of reconstructive surgeons.
Gotcha. So this is an important question that I have to ask. How do we keep the doctors here? I mean, cranking out, the medical students and getting the doctors to go here. How do we keep them?
That's the age-old question. And so studies have actually shown that you don't practice typically where you do medical school. You practice where you do residency. For example, myself.
Okay.
I went to medical school at Indiana University. Well, I haven't been to that state since I graduated medical school.
Okay.
Whereas I did my residency here, and here I am practicing here. Wherever you do your residency, you kind of make inroads with the community, you meet some of the other networking that's required, and so people tend to stay where they do residency. And this is where we have a shortfall in Nevada. Even though we have our own medical school, we're still missing out on a lot of specialties in terms of residency.
Gotcha.
So we have plastic surgery, we have internal medicine, family practice, gynecology, a lot of the main ones, but we don't have radiology. We just recently got anesthesia, just recently got ear, nose, and throat. We don't have neurosurgery. Recently we got orthopedic surgery. We don't have interventional radiology. We don't have radiology. So there's a lot of specialties that we don't even have. So these students may graduate from UNLV, they may even be from Las Vegas, and then they go to wherever state and do their residency, and they stay there. So what we really need to do to recruit them is not just have a medical school that's here, but we need to have the full complement of residencies.
Residency program.
And so that's something that the school is working on, and I'm actually myself working on expanding the residency program to 2 residents per year, if we can get the money for that. So it is kind of a budget cut thing here in a way, but that's really the way to keep doctors in Nevada is to expand the residency programs. And so that's the thing is a lot of people will go to medical school here, but a lot of the applicants last year left Nevada to do, or a lot of the graduating medical students left Nevada to do residency elsewhere, and we worry that they may not be coming back.
Right.
Yeah. So
Unless they have family here or something.
Yeah,
like that.
yeah, and even if they have family, though,
Right.
sometimes
Yeah,
that was.
if you've been 4 years, 5
Yeah.
years, 6 years somewhere else. That's tough.
It's tough, and it's funny when you say family, because I'm from Pennsylvania, and I did all my schooling, training, everything outside of Pennsylvania. Then I actually moved back to Pittsburgh. So I'm not from Pittsburgh. I'm from Eastern Pennsylvania, the Allentown area. And I thought, well, if I'm moving to Pennsylvania, that's a 5-hour drive from my family. They're going to come visit me in Pittsburgh like every weekend. Nobody came to visit me in Pittsburgh. And then the minute that I moved back to Las Vegas, all my friends and family, they'll make the 5-hour flight. They won't take the 5-hour drive to Pittsburgh.
That's the first thing that you learn when you become a resident of Nevada is all of your friends and family that you haven't spoken to or heard from in
grade
years
school up.
now are here to visit.
Yep. So yeah. But yeah, that's the main issue is we need to have more residency programs. And it just really comes down to expanding the medical school, expanding the programs, getting money for that. And that's, with Nevada really taking a hit with COVID.
Yeah.
Our state medical school, it's really hard to kind of grow that with all the budget cuts that we're seeing. And I think that we're hit a little bit harder than most communities because we're a tourism community. So that now we're kind of in a lurch because we have this brand new medical school and we want to expand all these programs. And as a state-funded institution, the state is really hurting because it's one thing to have some money for education, but then we have to say, well, where's that money going to go? Our teachers are underpaid. Our grade school teachers are underpaid. And so the optics of giving more doctors, these high-paying doctors, these more positions and opening residency programs to bring high-paying positions into Nevada, there's a good argument that maybe we should pay our teachers more. So people are always even fighting over the money that we do have. So.
Yeah, that's another one of my pet peeves there too. So
teachers are not compensated for what they do. I do not envy the teachers these days, especially in Clark County where they're having 30, 40 students per classroom.
Oh yeah.
I can't even imagine them and have to pay for their own supplies. But again, that's for another podcast, another day.
So you wear a lot of different hats over there. You is there of all the things that you do, the teaching, being a department head, the surgeries, all of that, is there one thing that you like doing more than the others, or I mean, is it oh yeah, I get to do this now, or oh yeah, God, I can't wait, I got to go over and teach a class or whatever?
I love teaching the new students and the new trainees. Teaching is really my passion.
Okay.
As a matter of fact, if I'm in the operating room and I don't have a student or I don't have a trainee, I'm telling the nurse, I'm teaching the tech, and they don't even care. They're like, all right, Dr. Brosious, like, we don't care. We're not learning from you. I love teaching. I love passing my trade on to the next generation. I think specifically what I do, even though the overwhelming majority of people are not going to go out and do gender surgery, every single one of those medical students will go out and treat a transgender patient one day. So I love teaching them how to interact with the transgender patients, like how to use the pronouns, how to say, what is a trans man? What does that mean to say someone's a trans man? What does it mean?
And yeah, since you brought that up,
Yeah.
would you explain to the people what is a
Yeah,
trans
let's
woman?
go back to this. Let's have
go to
let's have a
basics.
crash course in semantics of the gender expansive community. And so this may change by the time this airs. This is like an ongoing thing. I actually had to change. I give talks around the country actually on gender surgery, and it's almost like on a weekly basis I have to change the title of my talk because the semantics have changed.
Right.
So when you're talking about transgender, the way that we talk about it, they were born male and they transitioned to female. We say assigned, so a transgender male means that they were assigned female at birth, meaning that based on their genitals, we as a society assigned them female at birth.
That
They're
label.
female, yeah, that label. So we would say assigned female at birth, but a transgender male. So a transgender male would be somebody who was born with essentially a female genotype, but identifies as a male. And so that would be called a trans male or a trans masculine person. A trans female is somebody that was born with male parts, male genotype, but identifies as female. That's a transgender woman. So it's easy to think. The easiest way to remember this is however they identify, however they want to be called, that's what you call them.
Right.
It's real simple. Just
Right.
like my name's John, call me John. I come in, I identify as a woman, call me a woman. So that's a transgender woman. So somebody like you and me who are born male and identify as male, we're called cisgender. CIS. It goes back to the Latin or Greek or whatever old language that means same, and trans means opposite. And so we're cisgender men, whereas if you were born, had a female genotype, female sex organs, but identify as male, that's a trans male. So then you have non-binary. And so non-binary means that you don't identify as male or female, that you're somewhere in between, that you're a spectrum, that you have some masculinity to you, some femininity to you, but you don't really identify with either. And so that's kind of a non-binary person. And that's why Nevada has taken away the male-female on the driver's license and made an X as an option. So actually you can still be male or female, but X is an option. That's the third option.
Okay.
So X is what a gender non-binary person would identify as. And then you have gender fluid. So gender fluid is often confused for non-binary. Gender fluid means that their gender kind of changes depending on their social situation. For example, I have a patient who identifies as male during the day and goes to work as male and uses a male name. And at night, this person is in their entertainment world and identifies as female and dresses as female and goes by a female name and is not cross-dressing per se, but is actually living as a female. And so that's gender fluid.
Okay.
And so that person, depending on the context, may identify as male or may identify as female. So that's what the difference between that and non-binary
Depending on the
is.
social situation.
Yeah, whereas non-binary, wherever they go, they're always non-binary.
Gotcha.
Gender fluid may change based on kind of what their social situation is. And then you have the term gender expansive community. And so that kind of is the umbrella.
Yeah, what the hell does that mean?
So you may hear me use that term a lot. So kind of the blanket term for the gender nonconforming or gender expansive community. So you may hear me use those
Gotcha.
terms. So gender nonconforming would be any of those that fall underneath there. And that would be transgender, non-binary, gender fluid. And then there's, I think, if you look it up, there's like 50 named genders out there. But the common ones are the ones that I just mentioned. And then so they all fall under the umbrella of the gender expansive community or the gender non-conforming community. And so if somebody, and then pronouns, we can't have this conversation without talking about pronouns. So pronouns, same thing as however they identify, that's what you call them. So if somebody is a transgender woman, that means that they were born with male parts, but they identify as a woman, so you call them she or her. So when you hear people talk about what are your pronouns,
Right.
You hear this all the time now. And so, our pronouns would be he or his. For somebody who's a trans woman, it would be she or hers. And so however they view themselves is how we should be viewing them, and that's how we should be calling them.
I'm sorry, the non-binary would be they,
They
them.
and them, yeah. So that one's a little trickier for people because in the English syntax, it doesn't roll off the tongue.
Yeah, well, it's not something that we're used to.
It's not something that we're used to. Yeah.
It's something that older people especially have to learn this.
Yes,
That
and so
and anyway.
So the they them, yeah. It's something that doesn't. It's a little bit harder to grasp that in the context of the English language, but And most patients and most people in general in the community, they're not, if you use the wrong pronoun, they're not going to be malicious. So they may say, oh yeah, it's she or it's they. They may correct you. But as long as you're making the effort to show that you're trying to be, considerate, if you're maliciously calling them the wrong pronoun, that's a different story.
Right, and I think that's obvious at times.
Yeah.
So the other question that I'd like to ask for a lot of people out there, and is, does transgender have anything to do with sexual preference?
Not at all. And so it's funny because that you brought that up, because we lump LGBTQ into this kind of blanket.
Right.
A gay person has no idea what it's like to live as a trans person.
Right.
And so when we talk about gender is how you view yourself. Sexuality is who you like to sleep with. Those are two really unrelated things. Who you are and who you find yourself attracted to are really two different things.
So a transgender woman isn't necessarily, or isn't becoming a transgender, or isn't becoming a woman because as a man she was gay and she liked other men.
Yeah, exactly.
She is doing it because it's something, it's an internal thing.
Exactly.
It's not a projection, I guess.
Exactly.
Okay.
When they look at a trans person, when they look in the mirror, they see the wrong body.
Gotcha.
Whereas, somebody who's gay or lesbian or bisexual, it's who they look at and find attractive outwardly.
Gotcha. Okay.
So they're two completely different things. We lump them together as kind of this, community, but the experiences of them.
I think most people do.
Most people do.
That's what's in their brain, and so.
Yeah, and so that's why we kind of call that GSM, gender and sexual minority. But gender and sexuality are completely different.
Gotcha.
Oftentimes they are related. Like, a lot of people, for example, I did know somebody growing up who, I knew them as male, went to high school with them, and as they kind of grew up, they got married in a heterosexual relationship, then came out as homosexual, and then ultimately transitioned as a woman. And so all along, this person was a woman and was not homosexual, but because of society, the way we view, transgender people, a lot of times you'll see something like that and say, oh, that person became a homosexual, then they became transgender. No, all along this person probably was transgender, but they did not feel comfortable in central Pennsylvania coming out, and probably was uncomfortable coming out as homosexual, let alone transgender. So sometimes we kind of see that like, oh, it's more likely if they're gay that they'll become trans. It's not like they're becoming anything. It's just that society has put so much pressure on them to not be themselves that sometimes we kind of confuse sexuality with gender in a way.
That was my point.
But they're two totally unrelated things, really. Yeah.
So, well, I'm glad you clarified that.
Yeah.
So anything else that you'd like to talk about, or?
Where do we start? So, this is a great podcast. I had a lot of fun doing this.
Thank you.
I think, next time I come on, we can certainly talk about the situation of healthcare in the United States. We can talk about.
I would love to. Yeah,
one of my favorite topics is.
I was trying to avoid that.
Yeah, it's a polarizing topic.
Yeah.
And so, it's easy when I'm talking to somebody who has similar viewpoints like yourself.
Of course.
And so what's harder is when you have friends or family who have different viewpoints.
Right.
I'd love to come back and talk about that someday, or even
student loans. Or
oh my God, you can get me started. I still owe almost $300,000. I've been in practice for 8 years. Everyone says, "Oh, you're a plastic surgeon. You're going to pay those off in like 2 weeks."
Yeah, bullshit.
I'm still paying. I still have hundreds of thousands of dollars. I'm crippled by these loans.
Right.
So that's another podcast. And one of my favorite topics is tattoos in professional world. Because I am probably the only doctor, with a throat tattoo and my hands tattooed and mostly covered in tattoos.
So that's not just makeup for Halloween.
No, this is permanent makeup. Yeah, much to my mother's chagrin. So when I go home, people just look at me and they're like. And when I actually worked in Pittsburgh, I didn't have my hands.
Well,
on my
you can wear
tattoo.
turtlenecks.
I know, but it's up kind of up on my head. Now my hands. Now I can't really hide it a whole lot. But I get a lot of people. I have to say, a lot of people said that to hurt my career. And in Nevada, for number one, for what I do, and number two, every Starbucks barista has a tattoo or a face tattoo. So we live in a different world, and I'd love to come back and talk about kind of the social experiment that I'm going through.
Yeah, please.
For me, living with these tattoos and
listen, I'll make you the offer right now. I'll make you a regular. I'll give you your own fucking show right here if you want, man.
Yeah, I'd love to be a regular.
Yeah.
I like. I think that I have a lot to share.
I do too. Yeah.
I think I'm doing some good for the world, and I think I can be a role model in a way. And that's one of the things I like about being a teacher, and actually now having a voice. People are asking me to be on podcasts. People are asking me to write articles. And never in my life did I think I was going to have a voice, John.
Yeah.
And now all of a sudden I have a voice, and I'm trying to use it for a good cause. And so, yeah, I would love to be on your show again and talk about some other things that are important to me and that I think...
We'll talk about it after the show.
Yeah, I think that would be great. So
See, one more reason why WWDBTV is the place to be. So, anyway.
Awesome.
Anything else you'd like to cover?
No,
before
just
we wrap this up,
I just want to thank you for having me here, highlighting members of the community that are doing different things, and I just want to give
Listen, you being here is a real boon for us.
Good.
As a station.
Good.
Now, I don't know what we're going to be able to do for your career. We may screw it up, but
Don't worry about my career.
No,
I think that there's always going to be work for what I do. But the last thing, I just want to give a shout out to the gender expansive community. Thank you for welcoming me to be part of your healthcare leader in the field. I'm not transgender, so I don't walk in their shoes, and so I really appreciate that the transgender community has opened up to me and realized that you don't always have to be trans necessarily to help them out.
Right.
Just like you
can
don't
be
have
an
to be
ally.
black. Yeah, you can be an ally. And so I think a lot of people need to realize that you can be an ally. Don't be afraid to support things that you believe in, whether that's LGBTQ rights or minority rights. You don't have to be a minority to support minority rights.
Exactly.
And so that's one thing that I kind of want people to know, is that you can be a white male and push for social justice. And if anything, we may have a voice they don't have.
Maybe this is egotistical, but I think it's more important for people like us, white guys, to be verbal about that, because I think it has more of an impact. If you hear a black person saying something like Black Power, which I grew up with, so too many people, I'm tired of hearing that. But wait a minute, we're the ones that we have to, hey, I support this. This is another human being that's part of who we are and what we do, and damn it, grow up.
The golden rule, like I said, I grew up Catholic, not religious anymore, but the golden rule: treat others like you want to be treated, and just and my goal in life is leave this planet better than how you found it.
Absolutely.
You can be a giver or a taker in this planet, and so I want to be a giver. I want on my deathbed to look back and say, you know what, I think I made the world a little bit better.
Yeah.
Rather than I think I took everything I could from this and sucked it dry.
Yeah.
And so that's, I think, as white men, something that we can do is we can push for reform, because sadly we may be the only ones that have a voice in some of these matters.
Anyway, so how about telling people how they can get a hold of you, or if they need information, or
I actually have no social media accounts. I've never had Facebook, MySpace, YourSpace, Twitter. I've actually never had it. I need to actually get on social media, but I've never really had the time before. So the only way to find me is you can call my office if you're a potential patient, want an appointment. Office number is 702-671-5110. And I'll send you some links to some of the articles and things that I've written, and so you can through his connections you can see some of the things that I've done in the community, whether that's writing articles, those kind of things, and then just look for me to be on the show again, I guess.
Yeah. Doctor, thank you very much for
My
your
pleasure.
time.
Yep.
Appreciate it, and hey, thank all of you out there. We really appreciate your support. Thank you for watching us and coming back and supporting the other shows that we have here. Don't forget, we're now on Roku. We're growing there. We're still kind of new, but we're building it as we go along, and you're going to see some great things coming out. And remember, if you're going to do it with Stiles.
Nice work, John.